individual. We talked yesterday about the person-centered approach and how we can tailor our service according to the individual needs. So today we need to think about the positive outcome of the service, not only listening to what they need, not only listening to what their input. We need to see the outcome of our support. Are we really delivering what we meant to deliver? Is the customer satisfied? Not only the customer, we need to think about their families. We need to think about, for you as a leader, you need to think about your staff as well. You need to think about many people in the organization and the service provided and the quality of the service. Because for us, if we don't deliver high quality service, then we would not be able to continue to deliver the service for this particular person. Why? Because people couldn't change the organization. Also, the spread of words about our organization, if it is not good, then that will prevent people from joining in the future. So we need to think about all this when we deliver the service, about the outcome of our service. So for today, we're going to understand the theory and the principle which underpin the outcome-based practice. And also we need to be able to lead the practice that promote social, emotional, and also cultural and spiritual well-being. We need to understand what's their well-being and what's their ill-being, and how we can maintain the customer well-being for longer. Is it something just sustainable, or is it something we work on it? Also, we need to think about the inclusion of our service user or receiver when we make choices. Are we managing the service, or are we facilitating what the service user needs or require? So all this we're going to discover it today. We will talk about it. So first of all, we need to discuss, understand the theory and the principle that underpin the outcome-based practice. Can you tell me what's the outcome-based practice and how do you use it in your organization? Anyone would like to start the conversation talking about outcome-based practice? Obviously, there is a growing importance for the government focusing on the outcome base, focusing on the person-centered approach. Why? Because we're going behind. If we think about us as a country compared to Europe, we have more people to receive the service while we're providing very little of it. We need to provide more service. We need to think about the service user. So that's why huge pressure, lots of challenges. Why? Because we are not getting any younger. Our generation going older, and then we need more support, more service providers in the country to maintain and to control this demand. So the outcome-based practice is an actively process that beneficial the impact of on the individual life. So we need to think about the individuals, put it in the center of our activities, our customer. Think about the outcome of our service. Is it really beneficial to our service user? Have we achieved what we meant to achieve for them? Are we delivering what we agreed with them to deliver? We need to think about all this. We need to think about the service as a whole. So for us, for the service, there is an output, which is the effort we provide. for the service user, and there is an outcome, which is how much effect. Is it negative effect? Is it positive or negative effect on the service user? So we need to think about all this when we're providing our service.
Switch up around here. You will know that you will know that.
So if there is anything happening in the background, please unmute yourself so we can discuss. Okay, perfect. Thank you so much. So now with the growth of responsibilities for us as managers, personalization, and how much the government are focusing on these approaches. Also the budget, because now with the recession happening in the UK, we need to think about how much resources are available for every single center. Do we have enough resources to start maintaining an exceptional outcome for the service user? Is it affecting our work? We need to think about all this when we provide the service, and we need to control the service delivery, because for us, priority is the well-being for the service user. Do you think your service user always have this well-being? Can you tell me what's the difference between well-being and ill-being? Come on, I'm sure you're all maybe in supervision jobs, or I'm sure you have some idea about what's the well-being for the person and how you can maintain the well-being for the person. You don't want me to start pulling names and asking you to contribute. Can you contribute, please?
The well-being. Hi, this is Easy.
Hello, Izzy. Thank you so much for joining.
Hi. Well-being of an individual or your support is making sure the person is healthy, comfortable, and happy. That's person's well-being. The person is comfortable or what you're doing well.
Thank you so much. So if you think about it, as Izzy said, we need to think about the service user as an individual. They need to be happy.
Winning.
They need to be yes, success.
So
Would you
win
like
this
to add?
one.
Asha, please mute yourself if something happening in the background. When you start talking, unmute it and let us all contribute. Well done. Thank you so much. So we need to think about our service user at all time. There is increased recognition by the government about how important for us to listen to the customer, to understand their needs, to understand their requirements, and to measure the development of our work, how much the outcome are we getting? Are we delivering what we meant to deliver? Is the service we're providing is meaningful for them? What do you think makes our service meaningful to the customer? How we can deliver a meaningful service to the customer? What do you think?
Hi, it's Easy again.
Hello, Izzy.
A meaningful service that will give to the customer is something that the customer actually needs. You don't render a service to a person that you're supporting that you think you've used it for somebody else and might work for that person. The meaningful service is a service where you know that person will benefit from what is provided to the person. That's what is called a meaningful service.
Well done. Thank you very much. Thank you. So we need always to think, is what we delivering is meaningful to the customer? Are we giving them what they need? Are we delivering according to their requirements, to their needs, are we developing them in the best way possible? Are we contributing towards their well-being? So we need to think about all this when we provide the service. So according to the outcome-based approach, there are so many drivers for this particular approach. First of all, rising the demand for health and social care service. As we said, the generation are getting older. We need more centers because we like what we have now enough to what we can support, but in the future we need more. So first of all, there is rising demand for health and social care service. Also, we have, and also not only the older people. If you think about it, like mental health are getting more. Why? Because of the isolation we had in COVID period time. So there is also focusing from the government on mental health, also focusing on how much crime we have in the UK and these young offenders. We need to think about their well-being and how we can provide a positive culture for them so they can develop and become an important and effective people in the society. So lots of demand towards the health and social care. Also delivering the best outcome for the individual with limited resources. As we said, we have limited resources. Maybe we're going to get even less resources as we go ahead because of the financial crisis happening in the world. So we need to think about using the least resources we have to deliver the exceptional service and keep it going rather than reducing the service and thinking like, you know what, I have very little money, so I'm going to hire very less staff or get less staff working to deliver. But that will affect the service. So I need to think about more productive ways to use my resources while we maintain exceptional service. Also, we need to think about treating the treatment and care processing evaluated through evidence-based. We need to have evidence. We need to have auditing to the service. Like for you as a leader, you can't just expect that you're doing exceptionally well with your staff and not check the evidence base, not check the outcome, do auditing at the end and check whether the customer is satisfied. Have a word with them, get their feedback. You need to do lots of work to maintain this exceptional service for your center. So for you, what drives mean to your service and what the main impact? So for you, what's the main impact of these drives to your particular center? What do you think? Like, for example, if you talk about evidence-based approach, are you using, as a manager, are you using evidence-based approach in your organization and how that affected your work? How will that change the way you manage it and the customer satisfaction that you come in, you have in your center? What do you think? Yes, please, Otaya. Good to see you.
Good to see you too.
Thank you.
Hello, everyone. I think when you've got an everyday evidence-based approach to work, it gives you information that you can work.
Are you muted now?
Oh, sorry about that. Can you hear me now?
Yeah. Perfect.
Nice to see you all. Good afternoon. So evidence-based approaches can help to improve services. Every feedback is good, whether good or bad, and there's always room for improvement. And so I'd say that when you've got the evidence to back any system or process, then it's something that you can review. You can always take that back for review to improve on it or to check to see where things have gone wrong. Again, like I said, just to improve on it. And also it also helps you to measure performance, because I can see that people are doing things properly. And if they're not, then again, it's a case of whether we need to review processes or training needs, or in fact, the structure. So it helps to inform future decisions as well. So, and it helps to also show in the event that we had issues or that we were found not compliant, or even helps to prove that we are compliant in some areas. So it's information that you can archive, you can store, and you can prove that you've either done something right or that you're not doing it right. So it informs a lot of things: improvement, training needs, lapses in our system, lapses in our structure. It's always good to have evidence to back up as well individually, because in a care environment where things don't go wrong, it may not be as a result of what you've done, but at least you can show where you've taken over from, at least to a certain point. So it just helps to manage the whole system in all. Thank you.
Well done. Well done. Thank you so much for your contribution. Exceptional. Anyone would like to add? So in your organization, what do you think evidence-based approach has helped you? Do you use this system, and how has helped you in changing the culture of the organization? So as Oteya said, it helps a lot. Why? Because not only checking about what went wrong and the customer satisfaction, we need to see what we can do in the future to eliminate these errors has happened, and also how we can improve. Also, we can archive all these data and all this information to do further research in the future. We can build our reports to help all the staff, not only the management. And also maybe we can give training for the staff, that if they need training in certain areas, that would be great. Also, we have with the evidence base, we will have lots of information where we can discuss it with other people who are important to the service user, like their families, their carers. We have a lot of information we can discuss rather than just focusing on the work itself. We need to see a little bit further than that. How much are we delivering, the outcome of the service, and is there any evidence for where we are achieving excellence, or maybe how we can improve it at the end. That's perfect. Thank you so much. So now analyze the effect of the legislation and policies on outcome based. So recently the NHS have come up with lots of improvement to the service using the outcome measures. So we need to make it measurable for our performance. We need to focus on our on practice through the recognition of how much are we improving our client's life. Is there any growth, any limitation? We need to look at the resources we're using. We need to use the least resources available. We can't use all the resources for our work. We need to still keep some of the resources for other time. When I say resources, can you tell me what the resources you have in your organization? Give me examples, just in case some of the people don't understand what's resources. So what's the resources in your organization? Yes, Oteya?
So I suppose, for instance, with Mitres Care, you've got human resources, which is the staff. We have technology. So we've got platforms that we log into to record information about clients. We've got computers as well. We've got telephone systems that we use to communicate with each other. But yeah, I can think about the three at the moment: human resources, technology, and telecoms at the moment.
Absolutely.
So we use those three means, yeah, communicate.
Well done. Thank you so much, Oteya. Also, the money, the finances that we have is very huge resource for our work. If If we don't have this money, how can we pay for all these services, all these systems, for the people that we work with? So as Otoya said, we have the computer system, we have the staff, we have so many things we're working with, and also we have the money. So when we use these resources, we need the least amount of resources to deliver exceptional service. So we can keep this maintained, keep it going, rather than stop at some stage and think, okay, we spent all the money on that corner or on that activity, and now we don't have things to deliver. So we need, because you are the leader of the organization, I need always to think and use the resources well and not put it all in one direction. So now, explain the outcome-based practice can result in positive changes for the individual lives. Do you think in your organization, have you used the outcome-based practice and how that has affected the individual life positively? Have you ever used the outcome based in your organization? Can anyone tell me? Anyone who hasn't contributed to the class yet, please? I'm sure we all have used the outcome based in somehow in our work. So when you use the outcome based, you need to think about the goal of each person. What do they need to achieve at the end of the process? How they feel now? Is it going to change, make it better? Are they going to have their well-being at the end? I need to think about my staff, how we deliver the service. For us, now we think about the service user as the center of the activity. So the service user have got their goals, have got their hopes, have got their needs, requirements. So for us, we can't be the manager of this. We need to be facilitators. Why? Because we focus on the person as individual. Every person has got different needs. We can't just deliver the exact same service to everyone. We need to tailor the service to each one of these people. That's why we studied before in level 3 the equality, diversity, and inclusion. Why? Because equality doesn't mean we provide exactly and equal things to everyone. It means we provide equal opportunity. So everyone's got an opportunity to tailor the service to their needs. So this particular person, we're gonna offer him a different service from what we offer in this particular person, maybe according to their needs. So someone is on a wheelchair, so we need to think about how we're gonna improve their lives, how we're gonna help them to maybe take one step at a time, how we're going to take them outside so they can get fresh air. It's totally different from the service we provide for someone who's, for example, have got mental disabilities. And how we're gonna plan the service to support him or her as an individual. So for us, it's an exceptional to work as a facilitator rather than a manager. Why do you think it's a very good approach to work as a facilitator rather than just a manager to the process? Why do you think it's better? Can you think about you as a person? If you are a facilitator, that will help you to be creative rather than just following exactly what you meant to. If you're a manager, you're going to follow certain steps. Do you remember when we discussed about manager and a leader? So a manager will follow exact certain steps and stages to get where they want to get, which is needed for our work, but we are a leader and a manager at the same time. So same thing here. As a facilitator, you're gonna be creative. You're gonna come up with too many different exceptional solutions for the customer. to help them to live their life better, to help them being a great part of the society. So that's why facilitator is encouraging and supporting individuals to take control of their life. So for example, someone who had an accident, let us say a road accident, we're not going to be saying to them, okay, let me push your wheelchair, let me do this, let me do that for you. I'm not going to do this. I'm going to encourage them to do a little bit, a step more every day until they are feeling better. So facilitator means support individuals to take control of their life. As Otoya said in yesterday's session, taking the people to the shop, not only paying for them all the time, but maybe giving them the card and ask them to pay for what they purchased would be very helpful and very beneficial for them. Why? Because this will boost their self-esteem and make them feel really happy and satisfied. And that's why it's really good for us to be facilitators. And also for the individual to take control of their own assessment to support the plan that we put for them. So we can tailor our activities to their particular needs. And we will, when we do this, this will empower them. This will, they will provide us with the information needed, and we will help them, support them to achieve what they need in their own terms. So as you can see here, research by Harris at 2005 on the outcome approach of the assessment and review for people with disability found that the assessment based on the social model of disability identified 3 dimensions that support the positive changes. Let us first discuss what the social model of disability. What do you think the social model of disability? I'm sure you all work maybe with some people who've got disabilities. What's the social model of disability? Have you heard about this term before? So the social model of disability means that people who are disabled, they are disabled by the society. People in their head thinking, you know what, this one is a disabled person, he can't do this, he can't do that, he can't do this. Well, so they are disabled by the society. That's why called social model of disability. They can do a lot if we give them the equal opportunity, if we given them the same opportunity that we give to others. So we need to think about this. We need to provide them with the support and help them to do their own things by themselves. So when, according to Harris, the outcome approach of the assessment and review of people with disability have found that there is 3 changes or positive changes we can make. So change outcome, such as improving for self-care skills or building self-confidence, and also maintenance outcome, such as slowing down the deterioration of the quality of the life of the individual, and also the outcome associated with the process of receiving the service, such as feeling valued, being respected. So when we use the outcome base with people with disability, that will change their life. That will make them positively happy, make a positive change. Why? Because they know they have control over their life. Yes. So this control that will give them boost of self-confidence, boost of happiness. Also, it will help their life stop deteriorating. So if someone with disability, maybe this disability will increase over time. Someone who's on wheelchair have got some illness where his arms or his hands or legs will not move similar way as they get older. So stop their life from deteriorating. If we keep look at the outcome of our support, we will help them to improve their lives. And also the outcome associated with the process of receiving the service, feeling valued, feeling being listened to. This is all make them happy, and it will improve their life in general. So as we said, social model of disability means that someone believes that people who are disabled by the society. So as we said, you in your head, you think this person is disabled, they might not be able to do this particular things. So you do it for them. And that will make them feel really bad about themselves. You need to always encourage them to do things by themselves. Why? Because this will boost their level of energy, make them feel valued, important, will increase their self-confidence. You can't always suggest that these people need to be treated differently. So now, what research found was that service users who were associated using an outcome-based model, there is a huge changes in their life. Can you think about the changes that could bring to our service user if we use outcome-based model? What do you think that will improve their lives? In which way? Anyone would like to contribute? Come on, I don't want to be the person who's doing all the work with just a few students. I need everyone to contribute. So how we can improve? Yes, please, Ataya.
Sorry. So I'm going to cite an example of when we had foreign students who were new to the country, so refugees, so to speak. And one of the main priorities was to get these students, our clients, to be able to communicate with us because they had no use of English. And that in itself can be a disability in the sense that it's one-sided and they're unable to communicate in the community. And so with our support in getting them into local colleges, initially just teaching them words and helping them with their work, it was nice to see that by the time that they moved on from the service, that they could communicate to a certain extent. So a lot of the onboarding kind of services that we also incorporated in their care plan was to take them to the post office and to show them how to go do their own shopping, how to use their bank card. So we would help them to fill out the right forms to get the right things till they were able. So literally a form of rehabilitation, helping to introduce them into our society and our system. But the evidence at the end of that was that we saw people who came in who couldn't speak English and left our services speaking English. So just to cite an example, although I have worked in elderly geriatric care, but more mental health and more with our 16 to 18 provision. But that's just to cite an example of where we've got the evidence from our approach, from the initial approach to our care that we're providing.
Thank you so much. That's exceptional. Like, you have changed their life for good. You have improved it. You have given them sense of achievement, help them to integrate it with the society. That's an excellent example. Thank you so much. Anyone would like to share with us what they do and how using outcome-based approach has helped your customer? So as we can see here, using outcome-based model have made the customer more satisfied in the process. It allows for us to use better assessment to their needs and fully fill their needs, and also provide enhanced choices. So for us, rather than just providing specific treatment for all, now we have more choices because now we are creative. We start thinking about the outcome of the service. Now we have more choices to give to the customers, so they are in control in the overall process of their assessment. Also, the service user who had no difficulty identifying a broad range of outcomes. So each one of the service user, they can tell us, give us more feedback about the outcome of the service. Now they can recognize what happened because they were part of the process. Now they can tell us, well, you know what, we have tried this way, but I don't feel like we achieved everything we can achieve. Maybe in the future we can change it by this. They will give you suggestions. You can work with them to create the best outcome for their lives. So for us as a professional, it helps improving our service a lot. Also, most professionals they've been allowed to be creative. For us, I'm going to be very creative because the customer telling me what they want. So I'm going to think about other ways of achieving the same thing because we have used this process in the past, and we come up with some negative things. So when I do it next time, I'm going to be changing the process in a way that I'm going to bring more positive outcome. I'm going to be eliminating what happened there, using in the best way possible. So make you and allow you to be more creative. Also, the finding of the outcome, because we're going to study the outcome. As we said, we're going to do some auditing to the outcome and check. We're going to check with the clients about their feedback. So that will give us a lot of information to work with. We can provide better choices next time. We can provide a better control for the individual over these choices. So it is helping the client, it is helping us to achieve exceptional service in the center. So now we need to think about this, how it would affect your role if you were to adopt a facilitator rather than traditional assessor role in your organization. How that would affect your role in the organization. What do you think? Are you a facilitator or just a manager doing every day his job as you meant to do it? Anyone would like to contribute here? Are you a facilitator in your organization? Are you listening to people's requirements? Are you changing the process accordingly? Yes, please.
Sorry, it's me again.
Thank you so much. Thank you.
Thank you. Yes, I think based on my experience, I'm pretty much the facilitator because I've worked in management for a few years. And so my approach also is to coach. My approach is also to streamline processes, obviously, as we've gone through the years. And funding has been an issue in a lot of our work, economically, in every area in education, in social care, we've been struggling with funding. And so it's very important that we're able to manage resources properly and to delegate. And so that we're not duplicating what we're doing, we're not duplicating efforts. And so you almost try to have areas of excellence or champions in certain areas, but we work with our different strengths. So yes, modeling, I'm pretty much one of those facilitators that looks at individual people's strengths and places them together. So again, we're working as a team, but we're also working with our individual strengths, and we're bringing ideas together as well. So it's everybody bring your ideas to the table. We agree on our internal objectives along the government's legislation, you know, taking into consideration all the acts, the Equality Act, the Care Act, Child Protection Act. We work with the government regulations, but then we also set ourselves our own targets. So I think that approach is quite good, and it's flexible in the sense that we recognize that not one person has it all, but that we can together work to provide an excellent service.
Thank you so much. Thank you. Yeah, if you think about your approach, you said your approach is flexible. Flexibility is very important. Without flexibility, you will be constrained by exact same process over and over again. You wouldn't achieve the best outcome for your clients. I always like people to talk about flexibility and how they can change the process, tailor it in the future to achieve the best results. Because once you check the outcome, finding that there are some limitations, you're going to work on it in the future to achieve the best results for the clients. Well done. Thank you so much. Now, be able to lead practice that promotes social, emotional, cultural, and spiritual, intellectual well-being. So now we need to explain the psychological base of well-being. What do you think meaning of well-being?
I think it's a state where there's a balance. I think well-being comes with balance. Well-being comes with yeah, an all-round good feeling of calm. So you can offset the balance of your well-being. So anxiety can offset that balance. If you're overworked, it can offset that balance. So it's always finding that as a member of staff, and also for your clients, it's protection, it's safety, making sure that they're in a safe place, they're in a happy place, their nutrition is balanced, well-being. So it's really holistic, and it's quite a very broad area, how you quantify well-being, but you've got to create a safe place for your client. You've got to make sure that there are systems in place to protect them from harm, whether it be physical, mental harm. Nutritionally, you've got to have well-being, ensuring that you're providing them with good, nutritious food, and that the environment that they live in is also conducive, helps to give them a happy place, literally. So yeah, it's quite broad. So, but that's my understanding of well-being.
Thank you so much. Thank you. Anyone would like to add to the well-being? What does it mean to you, to your customer?
Hello there, thought I'd probably say something. Hi.
Yeah, hello.
One of the things I think is very important as well, just going by certain practices. I think yesterday I kind of touched on the Jewish community. They like to wash their hands before they prepare for their meals. That's a really important part of their well-being, and they won't touch the food otherwise, they, unless they wash their hands. But it's just to consider, sometimes some people have certain practices which we don't understand or don't practice ourselves, but having that mindful as well, and also in the care plan, of course, because our care plans, we know, are fluid, they change. And I think the whole point of a care plan as well is to kind of look at where they've started to see where they're going to end up. And it's a journey that they can participate in. They can see what's being actioned, what's going to take place. And more importantly, they are vocal in terms of what they expect to happen with them whilst they are part of our services. So again, it's just part of that. Thank you.
Well done. Thank you very much. Thank you. Anyone would like to add for the well-being and how it is affecting your client's life? So well-being, which means the combination of feeling good, feeling important, positive, being an effective part of the team, that you building your confidence, you achieving what you're meant to achieve. You are in control of your life. No one is forcing you to do things. You are an important part of the team, and you've been listened to. You've been understood. Your choices matters to the organization. You have a full control of your life. People, you have a sense of purpose is very important. People, if they live all their life without a purpose, like even you as an individual, if you go every day to work, then you go home, cook, eat, and sleep and repeat, and there is no purpose for your life, the life wouldn't be as happy and interesting and joyful. So every one of us, including our customers, they need to have purpose in their life. They need to have a sense of achievement. Every day there is something they are achieving. They are working towards. They have positive relationship. It's very important. If we are isolated, that will affect our well-being. So we need to have a positive relationships with friends, with colleagues, with our families. So that will affect on our well-being as well. Also, how much nutrition we have, our health is good. This is all effect on our well-being. So for you at the center, obviously when a customer just arrived, they have ill-being. They are not have well-being. Otherwise, they wouldn't be in care. So there is a trauma happened in their life, or maybe they are coming just from prison and they need to work on themselves to be a good part of the society, or maybe they have been raped, or they have lots of problems, or a problem has happened in their life. That's why they are in care. So when we think about our customers, we need to focus on bringing this good feeling for them, that they are achieving something, that they are contributing, they are part of the society. We respect their opinion. We don't enforce things on them, and their choices matters to us. And it is very important. If you think about using words, always think about the positivity as words. So when you keep saying negative words, that will create a negative culture in your organization. Let us say you have a team meeting, and all you talked about on that day is that we don't have money as an organization, and we're going to stuck with doing this, and we're going to do this. We're not going to achieve this because of the lack of resources. All negative, negative, negative. That will make your staff having this negative attitude, and then the whole culture of the organization will be negative. So you as a leader, you need always to use positive words. So even if you describe in some negative thing has happened, you need to describe it and talk about it in a positive way. What we're going to work towards, so we can bring the positivity. Always use terms and words which is positive to create a positive culture for you, for your team, and for your clients. So for us, well-being means that the person is in control of their life. They can make choices. They can be happy with getting what they want in life. They feeling positive about the future because we providing everything they want for them. That we always consolidate them. We always take their opinion. their feedback, and involve them in their care plan, in the process of achieving what that we meant to achieve. That all will bring a positive feeling and positive culture to our organization, which is very important. So reflect on some of the people you support in your service, following a dialogue with them, and about the quality of their lives. How this will, would you describe them as exhibiting characteristic of well-being or ill-being? What do you think about your clients? How you can check uh, about their well-being and how they progress in your organization? What do you think? What would you do to find out about your clients?
I think we can find out just by talking to them. So you've got your initial onboarding and the initial kind of biography that we're kind of checking or picking up on when we're building a relationship with them. So building up on history. And obviously you will know your client after a while. So, and sometimes it's just from having those conversations, asking them how they are feeling themselves, and also by observation. And also, yeah, observation and what you hear. So sometimes it might be that you hear them over the phone and you can pick up that something's not right. You might see that from their countenance. There might be some resistance. And you would know. So maybe where you've asked to do something for them or for them to participate in something and they're resistant and they don't want to. And they might not even want to eat. So it's observation. And also we can find out through conversation. Okay.
Absolutely, well done. Thank you so much. Anyone would like to add? So we can check on our clients by talking to them, by getting their feedback, discussing things with them. As we said, we need to make them feel valued, important. We involve them in our decision making. So we need to speak to them. We always talk to them and see how they feel at that moment, what change they would like to see. And also we can maybe supervise them, overhear them. Sometimes you even by monitoring them, like you see them from far, you see them isolating themselves, they don't want to get involved. Then you think they are not feeling satisfied or happy. Maybe you go and have a word with them to see why they are feeling this way and what you can do to bring this positivity back in their lives. It's very, very important to create this positive culture in your organization as a manager. Promote a culture among the workforce of considering all aspects of individual well-being in day-to-day practice. So the culture is very, very important in the organization. Like even if, for me, as a person, if I'm very happy and satisfied and I live in a very negative house, like I rent a room in a very negative house where all the residents, they are very negative, always talking about problems. Even as an example for this is really dragging person into the negative direction, because all you hear from day to night is all negative, negative, negative. So we need to create this culture where everyone is celebrating positivity, everyone is happy, satisfied. If you see one of the employees not happy or not satisfied, maybe take him on the side, speak to them and check what they are suffering from, if they need some support, if they need some training, if they have some problems, maybe offer him to take a holiday, support them in any way so they can feel important, they feel being listened to. Sometimes even being listened to is very important. Maybe they don't need anything, but they just want someone to listen to their problems. Maybe just talk to them is enough in their way. So creating this culture of the organization while establishing a pattern of work that we all need to be positive And for you as a manager, you can celebrate people's achievements. So for example, one of the employees has achieved something and make you really, really happy. Praise them. Talk about him or her in the team meeting. Let the others know about this achievement and how this make huge changes in the customer's life or his family's life. So you need to always emphasize on the good practice and always promote it, always push people to go towards the same direction and communicate it to the staff in one way or other way. And also send signals, like if you see something not satisfying, maybe have the person on site, talk to him if it is a customer or if it is an employee. Make sure that everyone promote positivity in your organization. It is very important. Sometimes people have everything, like you provide an exceptional service, you support them, you're giving them everything, you take care of their families when they arrive there, but they're still not satisfied. Why? Because there is no positive culture there. So you need always to think about the engagement, about the positive culture and the communication. So the staff communication is very important. A good practice, creating this culture where people are contributing to their own care and also being an important part of the decision making rather than things are enforced on them. So as a manager, you need to think about your responsibility towards all your employees, all your customers as well. And you need to engage with them rather than sitting in the back desk just looking on planning, on finances. You need to get engaged with the staff, ensure that you introduce well-being factors in the organization, promote changes in the way you treating others, and provide improvement to the culture of the organization. So, for example, here the staff are introducing the concept of well-being in the organization, introducing continuing professional development. So for you to make sure that the staff is working on the providing the positive culture, you need to think about the continuous development. So not because they just started, you offer them a training and you forgot about it later just because you don't have resources. You need to think about continuing development of the staff, always giving them training, always provide them with exceptional support. You can't just focus on the negative side of their work, also focus on the positive things that they achieve, promote it, celebrate it with the other staff. So this is very, very important to promote an exceptional culture in your organization. Be sensitive to what they need, like whether it's staff, whether it's customers. When you manage the service, you need to emphasize big emphasis on the crucial an important part of the well-being for everyone in your organization. So now explain how your staff development processes ensure the development of the positive culture that has individual well-being at its core. What do you think you can do for your staff to make sure of the well-being for the organization or the client of the organization? What type of development you can offer your staff? like in your daily activities. Can you tell us what you've been doing with your staff? Yes, please.
I think just to acknowledge good work and to celebrate good work as well. So if a member of staff is performing, then we celebrate that. If they've had great success or they've had good outcomes, then we celebrate that, and to encourage them also, and to have transparency. And I think another way to kind of promote staff on a daily basis, their staff development, is also to provide them with those resources in the first place. So whether it be through training, I like to create kind of smart sheets cards, that I put. So I've managed people who've sat at the front desk, and sometimes I create scenarios for them. So if a customer said this, how do you respond to that? Or we create a workflow. So if a customer asks for this, or a client came and asked for this, sometimes you don't know the answers, but it's knowing who to signpost somebody to. So it's also equipping staff with the right tools so that they're able to do the job, and making sure that the environment that we work in also is conducive. So we are bound by law to provide certain temperatures, for instance. We shouldn't ask a member of staff to work in a place that's below a certain temperature. So it's just making sure that there's health and safety in place to protect that staff and to enable them do their work, and also to make sure that they get work satisfaction. So one-to-ones will encourage that. So again, in your one-to-ones, you can find out how the staff is feeling about their work and if they need any more support. So it's a two-way stream rather than telling somebody all the time. You want to ask them, where do they see themselves in a couple of years? What would they want? And how best can we support them? Because sometimes it's got to come from them. And then it also allows them to feed back to you on your management style as well. It may be that you're impacting a member of staff negatively. So if you have those conversations with staff often, it helps to improve your performance as a manager and also to give them work satisfaction.
Well done. Thank you very much. That's exceptional. Thank you. Thank you so much. Anyone would like to add? So I do like what you said about this creating the cards, because this is giving them a training with limited resources. You're not going to send them to another organization to get training because you don't have enough, but you're still giving them lots of training in your own way and helping them to develop in it. Some of them, as you said, they might not know the answers with these exercises. You develop their skills and abilities, which is great. And also I like what you said about the feedback they've given you and how much you can use this information to develop your own skills, your own managerial style. Don't be focused on thinking like, I'm the best, I can do this, I can do that. No, I'm going to improve myself to the best way possible for my staff, for my organization, and to provide exceptional service for the service user, which is great. Thank you so much. Now, review the extent to which system and process promote individual well-being. So how we can review the system we are using to promote the well-being for our customers. So for us, we create a positive culture. Depends obviously on how much how our service, how quality service we deliver. So it is very important to communicate to at the senior level, and also to look at us as the leadership style. Are we delivering what we meant to deliver? We need to think about ourselves, not only think about our staff and the customer. To deliver an exceptional or a positive culture, we need to think about our performance as leaders and how much the senior staff are committed to achieving what we meant to achieve. So for us, we do supervision. To help the employees. Also, we do leading by example with the employees. We provide training to help this positive culture. We do everything we have in our hand to provide this or influence this positive culture. All the aspects of the service need to function very well. In the meantime, support the service user to the best way possible. So for you as a manager, you need to focus on the culture and also the system you provided. You need to always monitor the system in the organization and how much are you benefiting the individual and in the individual well-being. For example, here you have an example in the book of this where the group living service is organized so that the individual feel they have very little control over their environment. Another example might be the health service, where their confidence is determined by the decision which ignore their viewpoint. So for you, your customer, do you respect your customer's viewpoint? Do you respect their opinion? Do you follow it? Do you, as we said, we are facilitators. We are not managing the organization. We need to provide service which is tailored to our service. So if we ignore the point of view for our customer, if we not supporting them to develop, that will make their confidence shrink, and then you find the service user are very dissatisfied with the service. They are not following the policy, they are not following the procedure. You find them getting difficult with you and not want to be part of this culture. So you need to think about them all the time, about how you can make them happy and satisfied. As Toya said, we can maybe take them on a side, talk to them, discuss things with them. One-to-one helps people to talk about themselves. Once they feel they've been heard and their opinion matters, that will change their perception about the service in general. That will make them feel like they are important to you, so they can be contributing more. They can start telling you about what helps them to be better, how you can develop the culture to improve their life. So when you evaluate in your service systems and process, consider each one in turn against the well-being factors. So first of all, identifying which process supports support and undermine well-being. Which one of your systems could help the well-being? Which one is going to be undermine the well-being? And also, what evidence would you like or would you need to make a judgment about the well-being of the individuals? So for you, when you decide on the outcome, you need to see evidence, as we talked about evidence-based for your study. What evidence you can see? Are the customer is changing? Are they start having a positive outcome? Are they going? Are they start to getting engaged in the community more? Are they start to talk to you more? Being seen as like, are they contributing more when you discuss things with them? You need to think about all this when you create your own system. So any system you follow, you need to see the outcome. You need to see how much is affecting the customer, what's positivity bring into their lives, and what's the contribution, how you can develop it further as well is very important. So as you can see, as a manager of your service, you have an important role to ensure that that individual using the service who may experience feeling of ill-being are supported in a way that increase their feeling of well-being. Their approach is further enforced where the culture of the service ensure that all staff have awareness of well-being factors and respond sensitively to the individual needs. So you need, first of all, your staff to have an exceptional training. You need to lead by example. You need to have word with your staff so they can provide this culture for the customer where they feel valued, where they feel important, where they feel contributed to the organization culture. Now demonstrate the effective use of resources to promote good health and healthy choices to all aspects of the provision. So for you as a manager, how you can use the resources to promote good health and healthy choices in all aspects of the provision. Have you had any limited resources? I'm sure we all have limited resources in our organization, and how you manage to use the resources to the best way possible. Yes, please, Izzy.
Yes, hello everybody.
Hello.
And the resources like Tayo mentioned include staff. Most times we have limited staffing issues in the sense that like we don't have enough staff to cover shifts. And of course, it's quite important to make sure that we have adequate staff on every shift that we have. Sometimes some service users or residents might want particular staff to work 24 hours a day, 7 days a week, which is quite impossible to do. So we tend to want to just work with the service user to explain to the service user. The staff are all trained the same. They all have their own abilities. And if whatever it feels, because we just reiterate to him that like it's well-being that all staff are trained to make sure is to the best of itself. So it doesn't matter whether Stephen, he likes Stephen because he likes his music, or he prefers another staff that does hooks with him. So all staff have their own attributes. So what we tend to do, we tend to kind of, the staff that he wants for 24 hours, we kind of engage with him in the sense that like, that staff will do his 40-hour shift. Yeah, so use that staff as best as you feel you want to. Then the other staff, they have their own qualities, because when you actually speak with the service user, you'll actually say, you know what, you're right. I like him for this, and I like her for that, and like him. So every staff will have to actually provide for that service user, because the service user will now find out, like, you know what, all the staff that come and work with me are actually, they have their strengths, which he can actually work with. So I think that is that yeah, because you can't just get someone that will stay there for 24 hours. That's not feasible. Thank you.
Thank you very much. That's really a great example. Thank you so much, Izzy. Anyone would like to add an example from their work as well about that? About how to use the resources to provide excellent service to the service user? Yeah, so as Izzy said, we all need to contribute to the service provision. So everyone's got strength. Yes, please, Toya.
Sorry, yes. So I think another way that we do that is by putting in processes, checks and balances. So For instance, with Mitis, we have the login system where you've got to report on activities. There's also another sheet that has been created for staff to go through the basic chores they want them to go through throughout the day, which could be cleaning the communal areas, the fridge, cleaning out the fridge, making sure the bathroom's clean. And there's also a check against that. So you can say, yes, you've done this when and, you know, and who's done it. And I think as part of the client's care plan as well, it's to ensure that they are maintaining hygiene. So we encourage them to clean out their rooms. And staff have to actually report against this to show that they have at least prompted the client to either have a wash, excuse me, or to clean. And as key work sessions, it's also to encourage them to clean after they've cooked in the kitchen. So again, helping the client where they are self-catering to prepare their food in a nutritious way and in a clean environment, hygienic environment as well. So all those checks are being put in place for staff to follow, and those are being monitored because they've got to sign at the end of the day, or they've got to report back at the end of the day all that they have done. So those are measures that we take as managers or facilitators to make sure that we're providing good and healthy choices for our clients. And of course, a good and healthy environment for us to work in as well, just by making the staff accountable on a daily basis.
That's really, really good. Thank you so much. Thank you, Taya. So if you think about the service that you have, that's exceptional. That's really great. Why? Because you made the customer accountable to their action as well. It's not only giving them the choice, get them involved, being part of the society, how much they offer, how much they can clean their room, how much what they can do. This is all will encourage their well-being because they think that they achieved this. Even small things for every person, this is an achievement, and that will encourage them to have a better behavior, have a better outlook to the life as a whole. So that's really great system to follow. So now approach which is encouraging the healthy lifestyle for the individual. For example, maintaining the activities of daily living, like you said, for their daily living, they will be able to, for example, tidy their room, tidy their bed, do their activities for themselves, being able to be achieving this in the future. That will like encourage them to do more, and then suddenly they really don't need the support, that they can do everything by themselves, which is really great because that will help them to integrate with the society later on. Also, preventing diseases through physical activities and good nutrition and the stress management. So you're helping the client doing some physical activities, good nutrition, managing their stress. That all will help them preventing diseases. Also, the maintenance of function and confidence, that when they get engaged, feeling valued, feeling important, that will boost their self-esteem. So this is all very important for the client when they get involved rather than us doing everything for them. So this is really great. Also, the provision of health information on issues such as smoking, alcohol, obesity. So for us, as we said, we are facilitator. We're not going to be telling them what to do, but we will give them lots of information about these things. If we see someone who's getting like getting bigger every day because of what they eat, maybe we provide them, telling them that obesity could affect your health, will give lots of illnesses in the future. We provide them with lots of information that will keep them maintain their health, taking care of themselves rather than us keep worrying about them. We need them to take action for themselves and being important, being a positive addition to the society. So, and also the use of assistive technologies will enable the individual to live a healthy lifestyle. Can you tell me what the assistive technologies that we have in the organization?
Sorry, I missed the question, sorry.
Yeah, so what the assistive technologies that we have to help the customer to live their life normally?
We've got well, some people have apps through which people can communicate. Some have physical mobile technologies to assist people with mobility, hoists to lift them up. Safety buttons. So we have the emergency pull buttons in the bathroom. So if we have somebody who needs help, they've got that. So it's basically equipping the home with those assistive technologies should anyone need help that staff can respond to. And then also we have for staff, we've got our radios, or we've got those buttons, panic buttons in some offices. So I've worked in forensic before, and we have panic buttons installed around the premises should a staff be alone and in a place of danger. Then they can trigger that to call for other members of staff to come and support. And the same way we give clients those technology, so that if they need help, they can either press a button, and we're there to support them.
Well done. Thank you very much. Thank you. That's lots of assistive technologies. Even simple things like having the right glasses where people can't see very well and they don't need us to support them. The hearing aids, the wheelchair. There are so many assistive technologies we can use for the client that it enables them to live normal life rather than relying on us to do certain things for them. That will encourage them to feel positive about their life, to feel important, that they are they don't need our help. They can do things by themselves, which that will boost their energy level. So if you can see here, we have so many things we can help the client with. First of all, as we said, we encourage the client to do more of the things that they do for themselves, like tidying their room, tidying their bed, looking at what they're gonna wear. So this is all daily living activities that will help the client. Also preventing diseases by promoting good food or nutrition habits, and also physical activities, encourage them to do more activities. Also, we can provide them with lots of information if they need it about alcohol, about healthy lifestyle, about what they can eat, what they shouldn't be eating. This is all information we can provide them with using assistive technologies, and also getting support and help from health professionals if we need, as long as we can support the client to the best level possible with the least resources available. So now, we talked about the assistive technologies. Now, are we all aware what the assistive technologies that we can use in the organization, or you want me to repeat it? Obviously, we all use these assistive technologies to help our client to live their life normally, and making sense of the environment around them, and getting the best outcome for themselves. Now, reflect on a range of activities in your service that support individual to live healthy lifestyle. So what do you do in your own organization, in your own practice to support your client to live healthy lifestyle? What do you think? I'm sure we all do that, but each one of us in a different way. Depends on the clients we support in. Are they having mental health issues? Are they all the elderly people? Depends on the type of customer we are supporting. So what range of activities you use to support the individual to live a healthy lifestyle?
Hello, everybody. This is Izzy.
Hello, Izzy.
So, in Mitres Care, the client we actually look after, or rather support, is a 40-year-old gentleman. What we tend to do every day, we actually have an activity that we work with him and ask him if he would be interested. It ranges from having long walks. He goes swimming. Okay, he plays badminton. So, and then what we also do, we actually go to farmers market to pick out lemons, watermelons, fresh tomatoes, and he is being encouraged to cook a healthy meal, which luckily for us is actually interested in cooking. So that makes it quite easy for us. He knows that like he likes his meat, but we make sure he actually has that in moderately. It buys a lot of vegetables, so we tend to work with him. But like I said, we will always ask him, "Oh, is this something that you'd like to do today? Oh, I don't want to go swimming today. I just want to walk." Fine. The next day, do you want to go swimming? No, I want to play a racquetball, badminton. So I think like the choices, the options are laid out to him, and what he might refuse the day before, he might decide to do it the next day. So walking a lot, I mean, we tend to make sure he walks and he goes swimming. He tends to want to go swimming every day, but we always have to manage the limited resources we have. So he can actually do the swimming twice a week, maybe once a week. The walking is free, but it's quite healthy for him also. So that's my resident.
That's an excellent example. Thank you so much, Izzy. Anyone would like to share their customer experience and how you can help them to live a healthy lifestyle? Anyone? Okay, so as you said, he manages the resources. Every one of us has got very limited resources. We don't have all the resources available, but still we can manage to provide an excellent healthy lifestyle for our customers, excellent choices. So all the time, is he asks the client what they would like to do on that day, help them to do more of the activities they like, as long as the staff are available to help this gentleman to do certain activities, and help them to make a positive life for them. So anything they like, they encourage the client to do more of it. Like as he said, they encourage him to do cooking, to support himself because he loves cooking, and that makes it even easier for them. And also go shopping with them, daily activities. The more people walk and the more people do certain activities that will support them, help them to maintain this healthy lifestyle. Now, implement practice and protocol for involving appropriate professional health care expertise for the individual. So in your organization, while providing support for the individual in your organization, there is a protocol to follow, obviously, and guide for you in terms of appropriate action you need to take in certain situations. how to refer people to the health and care healthcare professionals. So these protocols is just like instructions for the individual and for the carers to follow. So a standard approach, what we can achieve, what we can deliver to the client, and we need to manage the risk involved as well. Like the client is telling us what to do. It's good we deliver the service for them, but how much risk is involved? We need to think about it as well when we deliver the service. So within your service, there are likely to be individuals who require regular periodic health intervention. For example, some people who live on wheelchair. We need to do certain things with them. So certain intervention is very important for them to live their daily life. We need to think about all this, about how much risk involved if they want to do certain activities. We do our sales, we need to concentrate. If there is no risk involved, then fine. But if there is a risk involved, how can we call the professional? What's the policy? What the procedure need to follow in this case scenario? So we are tied by this as well. It's not only following what the customer needs. We need to think about the organization as a big unit. Are we following the policy or procedure? Are we making choices work together well with that? So we need to follow the guidance of the health professionals. For example, a doctor coming to say, this person shouldn't be eating this particular food, for example, or shouldn't be doing this particular exercises. And the customer, obviously, he's got the right to do these particular things. But for us, our responsibility is to prevent this person from doing this certain activity. So there is a dilemma between what the person wants and what the person should have as well. Not only providing everything they want for them. We said we need to monitor our work to build it on the outcome of the service. So the outcome of the service should be helping the customer to be in the best healthy way possible and achieving what they want. But in the meantime, we need to think about what the professionals said to us and follow it to the exact. So if the professional said to us, the customer shouldn't be doing this, shouldn't be doing that, it's not good for them, then we have to enable the customer to get involved in the decision making. We should get them and discuss with them what the professional said and enable a good decision making for us and for them, rather than just following what they want if it is against their health. So it is very important that we follow what the professional said to us. So here we have an example. Mark is a manager of a resident home for elderly people, where a significant number of individual residents in the service are diabetic. Mark has recently attended a diabetic training program and is aware of the needs to plan for the care of individuals with diabetes. Older people with diabetes in residential care home are a highly vulnerable group with greater risk of increased diabetes, pressure, sores, and hospital admission. Obviously, when they don't follow the prescriptions, they eat a lot of sugar, that will make lots of complications to their health. So Mark has introduced screening for diabetes on admission and annual health review. he has arranged for staff to undertake delegated tasks following training by diabetes specialist nurse, enable result insulin treatment to be safely administered within the home using protocol planning with the individual and staff. Mark has developed an annual audit. We talked about the audit and how it is important to monitor our work. So Mark has developed an annual audit tool to assist the performance of the service in relation to diabetes care. So here, what process do you have in place to monitor the health of individual in your own service? In your own organization, like for us with this example, Mark has produced screening when people arrive to the center, so they know exactly what they have. Also thought about training, which provide for the staff, so they know exactly how to inject the insulin for the people, how to take care of them, of their food habits. So for you and your organization, tell us exactly what you've been doing to help the individual and the service user to monitor their health. Have you ever used any system or, yes, please, Kyle.
Yes, so although I'm not working with anyone who's got any health complication, but in the past, what we've done is it's followed on from a professional's request to either monitor blood sugar or to monitor their blood pressure, so with a blood pressure machine, and record that, and also through regular visits to the GP. So what we would have done is to arrange visits to the GP, and where we've been given prescriptions for them for medication, it's also to record that that's been given at certain times. So in terms of health, it's always prescriptive rather than us being the ones to, and it's really literally following the instruction of the health practitioner for that person. So I've worked in a place where they've had mental health and they've had side effects from the medication. That's probably, some of them have been put on steroids that push up their weight. Some of them have had medication-induced diabetes as well, and you start to see swelling in their legs. So again, it's to plan that in with their care plan to ensure that we're elevating their feet when it's needed, and also that we're following the prescription of the doctors or the health or the advice of the health advisors. But it's planning that in with every shift so that each person knows what they need to do, and that we're handing it over to the next person as well. So there's continuity. But again, it's just ensuring that we've planned that into their care plan, and that where we're having to monitor, that we're recording the findings every time we have to monitor, whether it's their blood pressure, blood sugar, or anything else. So the evidence, the recording of it, and also to ensure that it's planned in as well in their care.
Well done. Thank you very much. Thank you. Excellent example. Anyone would like to give us as well example about their own practice and how you can ensure that there is a process in place to monitor people's health? In your own organization?
Yeah, hello everyone, it's Izzy again. As
Hello,
I
Izzy.
mentioned, everything needs to be recorded, evidence-based. Okay, at every shift, it has to be, during the handover, what is recorded has to be shown and seen. No matter, even if it's a new staff coming in, the person has to actually be given a proper handover. I mean, well, verbally, and of course in writing, because once everything is recorded, all you need to do is just show the person, this is what we do. This is the times we do the blood pressure checks. These are the times that we do the blood sugar test. These are the times on the mark sheet when we administer medication. Everything has to be shown to the person whether the person is new or the person has been there. Every day is different. There might be times where the individual has decided, oh, I don't feel like taking, I don't want you to take my blood pressure at this time. Of course, they'll be encouraged. They can't be forced to take the blood pressure, but they can be encouraged on the later time or date. So if that particular time has been missed, your colleague has to be mentioned this. You have to tell the colleague this. Oh, we didn't do his blood pressure at 1 o'clock, but if you try him again about 2:30, he might agree, or she might agree. So these are things, and these are things like Terry mentioned, is evidence based. You have to be seen to have done what is meant to be done for your resident. Thank you.
Great, thank you so much. Thank you, Izzy. So this is all very good system to follow. You need all to be on the same page. All the staff need to know what has been, how you can follow a certain system to achieve the same process for everyone. So it's a great that the systems are using, and that you do your screening, you check the people's health, and you keep monitoring throughout the day and discussing, recording. This is all part of a good system. And I'm sure you all have a good system in your organization. Now, develop a plan to ensure the workforce has the necessary training. So how you can ensure that your staff always have the necessary training and that they can function very well.
Hello, it's Easy again. It's
Hello.
always best to have refreshers and just the casual chat with the staff. Oh, what do you think? Just little things like, oh, what do you think the 5 hours are? I mean, what are the residents' rights? You know, what do you think his rights are? Just casually, not as if the person's in an exam. But if you offer you wanted to administer medication to your resident and refuses, what should you do? Then let your staff say, oh, well, I'll force him to have it. Then you know that, like, the person isn't actually applying what is meant to be done. But what are the 5 hours when it comes to medication? The right to refuse, the right to medication, the right name that you have. Just simple things, simple steps you can ask staff. So just little questions, you will know that yes, this staff is on the game. And even if the staff comes back with the wrong answer, you'll now try to explain to the staff. Say, if like, for example, a resident, they say they have the right to make decisions that are not right. It doesn't mean that, like, if the client, you're walking along the road and the client decides to run across the road without looking at the cars, you leave them to go across the road because they have the right to make unwise decisions. So just making sure that, like, the staff and leaving posters around the facility, especially in the office. Few things just to remind the staff that, because to be fair, we can't remember everything. So just leaving captions around the office, the rights of your resident, the rights of what you should do in case of what numbers to call in an emergency, non-emergency. Just little things like that all around the office, just to remind clients what is the temperature of the fridge, what should it be, and what you should do, and what's the temperature of the medicine cabinet. You understand? Most people might not remember, but if you leave little captions everywhere, they tend to want to remember things like that.
Well done. Thank you very much. Anyone would like to add? Yeah, Tayo?
Yes. Oh yeah. So no, Nana, go ahead. You go first. I've been talking all day. Nana.
Nana. Yeah, would you like to add, Nana?
Thank you, Carol. Yeah, just adding to what Izzy has said, sometimes to the touching level, the for supervisions, there you will know what sort of training they need based on what they will tell you and or how they want to assess. And also sometimes we just get them caught up in emergencies. When emergency happen, how to it will prompt you to also check what sort of trainings they might.
Well done. Thank you very much. Thank you. Thank you, Nana. Anyone would like to add as well?
Yes, I just wanted to add that in addition to what Izzy said, you know, it's also that group team meetings. It's that meeting where we come together as a group to discuss what's gone well, what's not worked well for us. And I think that's an opportunity to support people with, you know, scenarios where they've struggled, and there we can come together and just to support them to do their job better. And I think another way to develop and encourage your staff is having that openness as well, where they feel that they can also talk or express themselves. So it helps, you know, and I always say about that two-way stream, that human factor as well, you know, and training is very important. And you know, Midas does so much of that training. But again, it's one thing to train, but like Izzy said, it's those soft conversations you're having with them just to make sure that, yes, they've had that training. Do they have the understanding? Because sometimes you train people and they never have an opportunity to experience what they've learned, because you either don't have that kind of client, or you don't have anyone with diabetes, or you don't have somebody who's struggling with alcohol or drugs. So they never really have an opportunity to work in that environment because they've not experienced it. So again, it's just those gentle reminders sometimes, like Izzy said, what are the 5 hours of, you know, medication, or what are, you know, just to check with that person. But I think coming together to have those group meetings are very important, where everybody can contribute to the way that we work. Thank you.
Well done. Thank you very much. Thank you. Anyone would like to add to what all your colleagues said?
Yeah, sorry. I just wanted to also mention, if you don't mind,
Yes,
most times, why this job is so brilliant is like whatever we learn either in training actually helps us at our homes. Take, for instance, first aid. I mean, most people, when you see somebody on the floor, you won't think twice to give them that 30 pumps just to feel that like you might be able to save someone's life. It could be your own child, it could be your brother, it could be your sister. So you learn, and I don't know if it happens to most people. Nowadays, you tend to, when the doctor gives you medication, you tend to find out what the side effects are. You see, that's what we do at our work, and that's what you now do at your home. So that's why I keep telling people, whatever you learn, whatever training you get, use it on yourself. If they train you how to do a PMVA, try it on your siblings, try it on your big child, and see whether you know what, it's easier for me to do it this way. Yes. So when that time comes for you to now do that PMVA on someone, it will kind of be second nature to you. So that's why I keep telling people, go back to the training, just ask your colleagues that are more experienced, how do you do this? What do you think about this? Honestly, it's brilliant. I mean, this is one of the few jobs that you can actually use your training at home. Thank you.
exceptional. Great. Thank you so much. Thank you for your addition. Anyone would like to add? So as Izzy, Toya, and Nana said, that you can identify how much training you need, your staff needs, and plan ahead by either, as Izzy said, by having a chat, conversation with them, and check on those skills from time to time. As well as that, like Toya said, we need to monitor the staff. Maybe we need to maybe do some supervision, check on their work from time to time to see if they still need skills, still need some development. And as Luna said, there are some sometimes emergencies happened, and then you see the staff stuck with certain situations. They can't be doing much, and they're all looking forward to meet or call the management because they don't know how to handle certain situations. So all this help the management to always think ahead and check how much the staff need support and need training. Also, there is the yearly review that you have with the staff will help you identify by having a chat with the one-to-one with the staff, asking them what they would like to achieve next, what they like to have training in next, develop skills, maybe shadowing another client, or maybe just asking the people who are senior around them, about what they can do and how they can do it best. So all this will develop your employees and also help you planning ahead to how much training and support you need to give to your employees. So all this are very, very important. For us as managers, planning are vital. Any complex situations, if we are planning ahead about how much training we can give to our staff development, that will make us go through even worst case scenarios easily. Why? Because all the staff are trained. We have the technology, so we can work with the least resources possible, and we all support and help each other. So if the staff employed having less skills, less abilities, that will make them stuck in certain situations. So by us planning ahead, that will make us, first of all, we can hire the people with better skills and abilities who've been working in a sector before. If we can't access to this because they might need higher salaries, then we have to think about how much support, how much help we can give them. We can ask them to do, for example, diploma level 3, diploma level 4, whatever. It helps them to provide excellent service to the staff. And then later on, we need to make sure every year there is, for example, equality, diversity, and inclusion. We need to do it every year to make sure that the staff still keep in their mind how to use this. Safeguarding, health and safety, all these issues, we need to keep monitoring them and keep giving the staff yearly training on them. Now, explain what workforce planning activities you currently engaging in. So at the moment, how much planning do you have for your staff? What are you planning to give them? What training are you meant to have, or you have planned for them? Can you share it with other people in the class? And what the changes you meant to achieve for your staff in your organization in terms of training, employment? Are you getting the best skilled people, or are we training the people after we employ them? What do you do? What's the practice in your own organization? Anyone who hasn't been involved in a class yet, can you tell me what's, because you all in a managerial level or supervision jobs, I'm sure you have lots of planning, or you had planning before to improve your staff skills and abilities. Or maybe when you're employing them or when you're hiring them, are you taking the best possible employees in terms of they're all qualified already, or are you giving them the training and the qualification, or asking them to go and get the qualifications while they are working with you? Are you getting volunteers? Yes, Izzy?
Yeah, hello everybody. Yeah, I think what Mitres does is like they go through a process of interviews. Is because what normally will happen is like they take on people that who have that passion for care. Like I always say, not everyone has that passion. I mean, we tend not to do this job because it's the highest paid job. We're not paid £50 an hour. Okay, you have to have a passion to care to actually start this work. Okay, so I think that's what Mitres sees the HR team. That's what they look for. They do a couple of interviews with you and find out, like, you know what, they'll ask you, do you have any experience in care? Everybody has cared for somebody of some sort, one way or the other, but not everybody wants to do it as a profession. So what they tend to do is like find out who wants to do it as a profession, find out if they can show empathy or sympathy, and then they carry on with actually now training them. Okay, training them. Some people actually come with experience. So they come say, well, that's fine. They ask the relevant questions, the person answers the question, say, you know what, yeah, that's come with your qualification, that's fine. Anything that we feel that we need to actually train you on, we will. Okay, so, but I mean, Mitres, I know, actually trains people, and either online or actually face-to-face. They did a PMVA training just a couple of days ago. Okay, so that's what it is, because you need to get the right man or woman for the job. Okay, it's very, very important. It's very easy to look after your own child or your own sibling. It's not very easy to look after somebody else's. Okay, so you have to follow the rules with somebody else's. It's very, very important. And once potential employees show that that they can do this, then that's when Mitres will now step in and say, you know what, we want you, we want your services, we'll train you to the best of our ability, and then they carry on from there. Thank you.
Well done. Thank you very much. Thank you, Azim. I can't agree with you more. The people have to have some type of empathy. They have to have passion towards the care, because everyone cared for someone in the past, but not everyone loved to care for someone who do not know, like just a client, which is stranger to them as a start. So not everyone has this passion. Most people, they just look for a job. So when you employ someone, you need to have this people. It doesn't matter whether they have lots of experience or not. You can train them, but you need to have good people who have this passionate, empathetic approach, be very kind when they work with others. It is very important. Otherwise, you can't train them, you can't give them the skills, you can't help them to get the qualification. But this personal values, you can't find in anyone. So when you hire people, you need to think about this massively. Well done. Thank you so much. So now explain the necessary step in order for individuals to have choice and control over the decision. So for us, when we work with individual, obviously we need to ask them questions. We need to involve them in the decision making. Not only the people who we care for, but also the carers, like anyone. The carers who are working for free to support someone. For example, a daughter who is carer to her mom, or a father who's caring for his young adult person who's got disabilities. So we need to work, think about the bigger picture. We need to help our client and also support their carers, support their families to feel good about the service we provided, share them with the decision making, help them to get a better idea about what we're doing and how we're going to support their child or their parents or our customer in the best way possible. We need to involve them in the decision making about also we need to involve them in our practice. We need them to be an active member of. So if you have something happening in the background, we're going to finish very soon. So please, perfect. Thank you so much. So it is very important to get them involved in our practice. So now, how to manage the resources we have as well is very important. We need always to think about the money we have. We can't just keep using the money or keep using more, for example, bank staff to cover. We need to be more creative. We need to have a mission. We need to have a goal. We need to have financial numbers where we follow. As managers, we need to have goals for our service as well. But in the meantime, we need to focus on the resources that we manage it accurately. And also, we need to provide an excellent results for the individual with the least resources we're using. And also, we need to have a professional discussion with for example, with the doctors, with anyone can get involved with us in our client to get the best possible way with the least resources that we can achieve. Obviously, involve them in the service, as we said. We need to involve the client in our decision making and involve their family and involve their carers. So here we finished this subject. How did you find it? Did you find it difficult or okay? Very much similar to what you do everyday process? Do you need me to explain more about any aspect of what we discussed?
No, I think this was quite interesting too. Okay, and I think, well, your presentation is always magnificent anyway. So I think everyone, well, I speak for myself though, I think I've learned quite a bit out of this. That's really coming from yourself and from my other colleagues. So I think it's quite understood. Thank you. Thank you, Lana.
Thank you so much. Thank you. Your comments is highly appreciated. Thank you so much. That really means a lot to me. Thank you so much, Izzy. Anyone would like to ask any question? Okay, well done. Thank you so much. We survived our yes, Anna?
Yeah, sorry, Nana. It's about the assignment yesterday you mentioned. I'm sorry, my apologies. I wasn't on the platform then, last week. So I'm kind of a bit confused because the one you sent yesterday has an assignment on which is 800 West, and I saw two other assignments. One is 600 West, one is 800 West. I'm not sure which one are we meant to submit possibly by Friday, if you don't mind.
Yes, I need one assignment at a time. It's very good if we can do every week, submit one assignment because there are five actually. First one with no assignment. So we have 5 assignments. Let us all contribute every week. I'm going to ask everyone to submit at least one assignment. So by the time we finish our course, that means we nearly there to finish the rest of the assignments. I don't want you to stuck at the end and then you will find it very difficult to finish. Every week, let us submit.
Sorry, all the 5 assignments are on the platform, you mean? I don't have that information, I'm sorry.
No, every time I'm sending you a chapter of the book and the assignment. I can send it again if you like.
Please.
Sure, absolutely. Absolutely. Please, I will send it again.
Thank you.
Very happy. Welcome. Caroline?
Hi, Lana. I'm a bit unwell today. Is it possible to get the recording for today's session?
Definitely, I will send the recording. Yeah, I had requested from the manager